60 or 70% versus a 95% effectiveness. So, you know, these are the things, I think these are some of the things that the people in the country want to hear. Because I don't think the persons or the people are so much against not taking the vaccine. But I think they are concerned about the effectiveness of the vaccine itself. I think that's the major concern. But it could not go without saying, you know, I'm hearing a story from Council Faith for the first time. That this is one of the problems that we face as a nation. Because if the health professionals, if you go to a doctor's office and you say you have asthma, but because of the stigma of corona, you are not going to be treated, then that is why. I know a person who have had symptoms and now them says, go to the doctor or whatever, they might call me. They are afraid to go because of the stigma and they are just, so I think with all of this, from a health professional standpoint, I think there has to be something more done. Because corona, even though we're taking the vaccines and there are new strains, we don't know what will happen. But I think we have to get a little bit more from the health professionals in terms of how is it that these people are treated. I mean, we may have to say that if you know it's asthma, you have it. Walk with something to show that you have asthma. But there should be a thing to say that this is a space for this. Because, I mean, we could have lost her like how we lost the young lady, but, you know, it is pathetic that, you know, we are treated, our persons are going to be treated that way. Because even the situation though of persons who may turn up for other illnesses, because those persons may not be showing signs that they may have the coronavirus. But again, there are a number of persons who are asymptomatic but still turn up at these hospitals for other related sicknesses and otherwise. So I think it should be a situation where all persons going into the hospital should be tested. Because I hear of stories, persons going in for one illness but still contract the virus while in hospital and they're not placed on those wards. So I think those are some of the things we need to probably look at and to see how best. I hear Councillor Mara talk about a committee. Councillor Mara, we do have a committee. Well, let me tell you the situation. When we started the committee, it was a committee of with persons from the region, all 4 MPs, etc. Even the members of parliament left the group. Because if information was not being shared in a way that you could easily communicate and talk to persons and assist, then it didn't make any sense. Because there are certain information that you need as a councillor to assist your constituents or your community person, which you will never ever get. Because as Doc stated, a person's health information is their personal business. And so what we have to do is just continue to talk to these people, to tell them to be safe and all of that. But there's one question people have been asking. When you take the vaccine, say you get the 2 shots, what is next? Can I now put away my mask? No, because that's the question, because people are saying, if I can't do this, why take the vaccine?
I think the councillor who went on, who raised this point, also mentioned the encouragement of other participants outside of the hospital space who would engage and they would be dealing with those persons who are considered to have a mild case. Think about COVID is this. We keep hearing of new strains and so on, and they sometimes affect individuals differently. So our patients today, they may be maintaining their saturation, which is the amount of oxygen in the blood, etc. And they may seem fine, but sometimes some patients deteriorate very quickly and require equipment that we cannot move to these particular facilities on such short notice. So they have to be in a central space in a hospital setting where we have the equipment and can facilitate the proper management of those patients. So until that patient is completely considered recovered by the medical team, it would not be safe for us to just move all patients to other facilities. I must add, however, that there are persons who are are in the active phase of the illness who do not require hospital care and are allowed to remain at home. We do offer some amount of guidance, and that is why we have publicized the numbers of the COVID-19 hotline, so that if you have any questions about how to quarantine at home or how to isolate at home, we can guide you. Many persons have been utilizing the service, and if there are others out there, I would like to repeat the numbers at this time. 961-0128. That's 961-0128. 788-6270. That's 788-6270. 807-3492. 807-3492. And 807-3551. If you have been told that you are COVID positive and you are within your active phase and nobody has called you, call us. Somebody would have told you your result. Call us. If you have a suspicion that you may have COVID-19, you can call these numbers as well, and we will guide you how to be tested and how to manage if you have to remain at home. The next question, antibody testing? No, we do not have any official place in Mandeville that is offering antibody testing. In Manchester, I should say. All right? I did forget to mention Mandeville. It is a type 3, and yes, we'll be offering vaccinations from here. So thank you for that correction. In closing for this section, I'd just like to say, regarding the asthmatic situation, asthma is a chronic health condition, just like hypertension, diabetes, epilepsy, and other things too. And one of the things we like to remind persons with comorbid conditions is this. One, you need to stick to the regime or the regimen that your practitioner has set up for you. In terms of these particular comorbid conditions, usually you're on medication. It is important that you take your medication as prescribed. So for persons who are asthmatic, it is important that if you are on a controller, you take your controller as directed by your doctor. Make sure that you have your rescue pump as well, right? So that you can start your management and reduce the likelihood of you having to go to a healthcare facility. I know that is a terrible experience that you had. I have seen persons with asthma who require care immediately, who through no fault of their own, they have tried their best to control their condition, but something happens and they require health care immediately.